Today I wanted to demonstrate what a Bell's palsy treatment might look like. There's a lot of misconception out there about acupuncture and especially with face acupuncture, that you might end up looking like Hellraiser from the movie with, you know, hundreds of needles in your face, and also kind of a misconception that the needles are really big as well. So you can see from our patient here, kind enough to let herself come on camera, we've got some very shallow needles. The Japanese needle is the thinnest needle available. In most cases, it's barely breaking the skin, but it has a very strong effect on moving the energy and relaxing tight muscles. Bell's palsy affects the cranial nerve number 7. It's due to inflammation and swelling in the nerve that then affects these associated muscles and the energy lines that come up to the face. Mostly the energy lines coming to the face from an acupuncture standpoint are the stomach meridian, small intestine meridian. Sometimes that could indicate that there's some small intestines or stomach digestive issues going on, even inflammation in those organs that might be transferring up. But from a Western standpoint, it is because of swelling, inflammation on that cranial nerve 7. So here you can see I did a point that still has some numbness. Her condition's really progressed well, and she's had this for a while, but this is the frontalis muscle. So it helps with the stimulation and getting the nerves to repattern and the muscles to fire better. We have a point here called stomach 3 from an acupuncture standpoint. These two corner needles are for the zygomatic major and minor muscle, which are the muscles that actually lift the corners of the mouth when we're smiling. And in this case here, she still has a little bit of trouble crinkling the forehead, opening the eye completely, and then smiling. So stimulating that zygomatic muscle is going to be very effective as well. So now that they're out, can you speak a little bit? Did you feel very much when they go in?
Oh, absolutely not. No, you don't feel anything.
And then when they are in there, what are you feeling as far as the sensation when you're laying there for about the 20 minutes?
I feel like something's going on.
Like a thumping?
Yes, like there's a sensation going on where I didn't feel it before.
Okay.
So it feels like it's working its magic, honestly.
That's a good description, because it does feel like there's sometimes a warming feeling with the needles in there, sometimes a little throbbing or thumping, like she said, indicating there's a lot of blood getting moved to the area as well. And then since this occurred, and I know in your case, it's sometimes Bell's palsy happens and resolves in 3 to 6 months for some people. Yours has been a little bit longer, several years, and we've taken a couple of attempts at getting this better, but it's really improved from the very beginning.
Oh, definitely. From when I first started, it was numb, where I couldn't even smile. I couldn't even frown. It looked completely off. One side was completely numb.
Yeah.
Now I can smile a little more. Maybe it might not be straight, but I can smile more and I can feel more.
Yeah,
I feel more confident. So
awesome.
It's been amazing.
It does look about 90% better, I would say, and we're still working on getting that remaining 10% to be better as well. Here I'll do a technique that's actually a stimulating technique for sort of the whole area, and it's a face. Another very gentle Japanese pecking technique that's stimulating for the whole area. In a way, some of you have heard of the face roller, where you might roll your face to cool your face down or relieve a headache. So this is similar, where it's stimulating everything. It's about every third poke is just a little tap from the needle, and then many pokes are actually just my fingertips. So it's a bit of a massage pecking technique as well. I also do focus on the masseter muscle, which is our jaw clenching muscle. and that is also very effective in the Bell's palsy treatment as well. This is the first half of the treatment. I always turn the patient over and treat the other side, which is very important in the Japanese style to do a front and back treatment. With face problems, there's a lot of neck and shoulder tension, so we'll work on relieving that neck and shoulder tension. Thank you for watching. Please like and subscribe, and we'll see you next time.